Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the COVID-19 update show here live on ITV networks every Monday to Thursday. It is a Tuesday morning, the 27th day of Sha'ban, 1441. It is the 21st day of April 2020. A bit of a change on today's show, inshallah. We'll speak more about it later on in the show. Firstly, this morning we understand with regards to the confirmed cases here, infections cases here in South Africa above 3,300. We see the deaths are now standing at 58. Once again, we ask Allah subhanahu wa ta'ala to make it easy for one and all those affected by the coronavirus pandemic. Allah subhanahu wa ta'ala grant them complete shifa and a speedy recovery and full strength. We say Ameen, Thumma Ameen. So that's on the South African front of things. As we know, those most vulnerable are those living in the day 26 of the lockdown, not able to go out and get some work, wherein from that work they are able then to buy daily necessities, milk, bread, etc., to provide food for their families at home. So inshallah, we'll focus once more on organizations that are responding to the call of the needy and the destitute during these difficult times. Another breaking story from last night has been going around with regards to Makkatul Mukarramah, the Saudi Arabia Makkah Tarawih that is going to be performed in the Haram this year. It is going to be performed behind closed doors. This is what the information we are receiving, and that only 10 rakats of Tarawih will be performed, and the Khatam will take place on the 29th night of the blessed month of Ramadan. So as that develops, inshallah, we'll keep you up to date. So we see in Makkatul Mukarramah now, lockdown also being in effect throughout the entire month of the blessed month of Quran. We'll speak more about that, inshallah, tomorrow or Thursday morning. But this morning, inshallah, we're going to Ermelo, where we are speaking to the chairperson of the Giving Hands, and that is Brother Muhammad Bayat. And we say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Muhammad, and Jazakallah for joining us on our COVID-19 update show.
Alaikum salam wa rahmatullah. Jazakumullah khairan for the invitation. Much privileged.
Alhamdulillah. Mohammed, we're talking about day 26 lockdown here in South Africa. Firstly, how's the lockdown being for yourself and the Ermelo residents?
Alhamdulillah. I think personally for myself, the lockdown was, it didn't feel much of a lockdown in the initial days. I kept myself quite occupied with work, but I was quite worried about I think post day 5, day 6, where things start slowing down from a work point of view as well. It's just so much work you can do from home. And alhamdulillah, we then embarked on this charity drive, and I think I'm working more than I usually work, so alhamdulillah. So lockdown has not been, personally for myself, I have not really felt the pressure of lockdown. Although I've been working from home, I've been staying at home, and even the charity drive that we're doing at the moment, we're not really getting out in the public space, if I can say. Ermelo as a whole, shukr, alhamdulillah, we don't have any cases within this district municipality. We're one of few municipalities that has 0 cases at the moment. But as we all know that, you know, this reality could change within the next hour, minutes. But inshallah it doesn't.
Mohammed, before we go on to the next question, if I can just ask you to move the other earpiece away from the laptop, some sort of interference coming from there. With regards to the Giving Hands, can you explain to our viewers or give our viewers a brief history of the Giving Hands organization?
So, the Ermelo, under the auspices of the Ermelo Muslim Jamaat, we have the Ermelo Muslim Welfare. This welfare predominantly focused on zakat recipients within our community. So pre-lockdown, through the women of our organization, they went on a drive and they went about distributing hampers to the recipients that we normally deliver hampers to. And it was about around the 9th of April that I seen a post on Facebook of a certain brother that actually went about advertising assistance. And I looked at this post and I said, this is, while this is very depressing times economically, financially, but I think as believers, we believe greatly in giving sadaqah and the protection that we derive from sadaqah. And I said this opportunity of COVID-19, the reality of it is there are people, and this was now 9th of April, this was almost into week 2, and I began thinking about the wage earner, the person that is self-employed, but is self-employed as an independent painter, plumber, tiler, etc. And I thought these guys are generally working day to day, not even week to week. They probably at the point of starvation. So that together with that, I and the Amala Muslim welfare, we had a mashura, and we discussed what as a community what can we do, and alhamdulillah I put the post out on Facebook myself, and within a short while, like within minutes, we started receiving WhatsApps, because we had put three numbers out, and we started receiving WhatsApp inquiries that far exceeded what we had expected. So this resulted in us mobilizing the working group, and alhamdulillah, in the small towns, to mobilize is not a very difficult thing. So we mobilized the working group. We engaged supermarkets to kind of identify what would a hamper cost us, and then together with that, we through the social community WhatsApp groups, we advertised for people to come forward and give us the sadaqah, and give us the zakat, and give us the contributions. Alhamdulillah, through the zakat, we managed to reach out to the African Muslims, and we have a good database of that through our Sadaqatul Fitr programs. So we have a good database of those recipients, and we were able to reach out to them within 24 hours. We reached out to just about 300 or 400 of those recipients. Together with that, we had some sadaqah that had come in, and by the end of the week, so this was 3 days later, so within 72 hours, we had already, alhamdulillah, we reached out to 1,000 families. We did this, considering the regulation and the constraints that COVID-19 brings with it. We had to also be sensitive of not going into the areas and do a distribution, because I think the hunger is something that is not limited to just the households that we may identify. And we also had to be responsible in ensuring that our volunteers are not put at risk from looting, etc. So we used our database of recipients. Together with that, we advertised these WhatsApp numbers, as I mentioned earlier.
Yes.
We collated a database entirely on WhatsApp numbers. The credibility of the database and the credibility of the recipients could not be verified. But we then realized that we were at a point where we now reached 1,000 people, and we now didn't have more sadaqah funds, because the inquiries that came in were not coming from Muslim families. We then engaged the mayor's office, and through the mayoral committee, we wanted to know from the mayor's office who else in Ermelo is doing social work of this nature under the COVID-19 food security crisis. So it was quite alarming that there was no organization doing this, and no organization doing it formally. So they might have probably, and there is, and there were a few smaller organizations or organizations doing it in a smaller way. So that was the birth of the Giving Hands. So we said the Umlo Muslim Welfare will be an affiliate to the Giving Hands, but we need to have a joint response action. And we need this joint response action to mitigate any duplications, we need to reach out to the needy without replications. So that's where the Giving Hands, the birth of the Giving Hands came about.
Mohammed, up to date till today's date, what has been the organization's response to the COVID-19 pandemic? You're making mention with regards to the recipients of food hampers and parcels, etc. Do we have numbers as to how many food hampers or parcels have been distributed? Is there any sanitary packs that have been distributed as well?
So the hamper has been very, very
You can carry on, Mohammed.
Oh, sorry, I thought I lost you there.
No.
The hamper has been a very simple hamper. We originally started with a hamper that was valued at about 250 rand. When the inquiries started increasing, we reduced the value of the hamper, reviewed it, and we went down to a hamper of 140 rands. And with the increase in inquiries, we went further down. And the increase of inquiries, from the WhatsApps, and my cell phone number was one of those numbers that personally became viral. So a lot of those WhatsApps, we could actually feel a sense of desperation, and from trying to mitigate and protect, and at the same time suppress the starvation out there, we looked at forming a hamper that may not last for a month, but may last for 10 to 12 days for an average family size of 3 to 4. So at this point in time, when the Giving Hands was formed, I actually did a YouTube video that went onto the Giving Hands website. Within a very short time, we mobilized IT people, we mobilized people from different communities, and we brought all these resources in to try and streamline as much of the collation of the data, and to be able to also give the organization credibility, because we needed the private sector's buy-in. In terms of Zakah funding, the Umlo Muslim Welfare has its credibility, but to be able to share credibility with the Giving Hands, we needed the private sector. And we needed to also make sure that we have the structures in place, the Facebook page, the website. Together with that, we've used the website very well, alhamdulillah. With IT advice, we've now having people go. We have an SMS line and we have a WhatsApp line, where people have access to internet. They can go and upload a very simple form, and that form automatically goes into our database, and we're able to validate the database with duplications and checks against ID numbers. So we have, after this morning, after yesterday, we've already reached out to a further 1,000 recipients. But we also looked at family sizes. So where the inquiries came for families of 1 to 4, we gave 1 hamper. Where the inquiries were family sizes of 5 to 8, we gave 2 hampers, and so on. So we gave up to 4 hampers in some cases. But we also realized that together with this, there's also abuse that takes place. So the database, all of a sudden, the inquiries in the database started having inquiries of 18 and 20 household members. So we took the stance of saying we're going to be giving 1 hamper per inquiry, and this we started doing from our distribution of yesterday. Inshallah, tomorrow we have another distribution of another 500, and inshallah by the end of this week we should reach to 3,000 homes. So the funding is there. The money has come in quite well from the wider community of Ermelo, and this includes the non-Muslim community of Ermelo. And Alhamdulillah, it's also with all the negativity and all the cons of COVID-19. I think it's quite encouraging to know that under these circumstances, we were able to mobilize and network a community. My mission and inshallah my ambition is that post lockdown or post COVID-19, if the Giving Hands can have the credibility that it desires to have, the Giving Hands will inshallah be able to have good affiliation with business, with private business. And it might be in a position to continue sustainably. And if our database is accurate, and if the database has good validity of the real unemployed people not receiving any form of assistance, any form of grants, they're really not having any income at home. They're really the needy. We'll be able to work off a smaller database at that point in time, and we may need less funds, but we may be able to do more with less. So inshallah.
Mohammed, lastly, with regards to the organization, we see it's an infant organization, but alhamdulillah doing a sterling work so far. Anybody that wants to help assist with regards to maybe even some time or the expertise or even some money, how do they get in contact with the Giving Hands?
So you're welcome to share my number with anybody that wants to not partner with the Giving Hands, but wants to understand how the Giving Hands or what the Giving Hands has done. Together with that, I'm hoping that we have listeners from the Khair Sibande district municipality, because on Sunday we had a conference meeting with the MEC for social development. And social development are helping us hugely to validate our database, so that we don't have duplication of what they're doing. And together with that, they also have access to the SASA database. And they also, I'm hoping that through the network that through the relationship that we've now created, that we'll be able to get access in future to the URF database. If we're able to get access to all these databases, we can then work with an unemployed database. So in that discussion, the MEC informally gave the Giving Hands, or gave me and the Giving Hands, the green light that they'd like to work with the Giving Hands for Khair Sibande. Purely because we're bringing, we're merging the private and public sector, and there's accountability in the process. Right now we have a brother that's doing sterling work in Secunda. We have the Khair Sibande municipality stretches from Balfour up to Impuluzi, better known as Badplaas. So it's made up of, I think, 7 or 8 municipalities. But currently there's definitely a need for this form of work to take place in all these municipalities. And while Islamic Relief, together with Islamic Relief, we will be distributing via social development, almost 1,000 hampers will be distributed, inshallah, on Thursday. But that too, Islamic Relief will find comfort in knowing that the Giving Hands is overseeing the project for them on this side. The MEC is quite comfortable that she's giving the Giving Hands the custodianship of handling the Islamic Relief hampers, and Department of Social Development is bound to work with the Giving Hands in making sure that we reach out to the recipients that they've given us to. So I think at the end of the day, in the bigger picture, with I'm not a politician, but I think the private sector has its reservations of wanting to work the private sector has reservations of wanting to work with the public sector. But I think if the private sector can can find synergy. And that synergy, I think the public sector has a lot to support and give the private sector to be able to move forward. But together with that, as private sector, we have expertise and we have know-how and we have the resources as well to be able to support the public sector in becoming more accountable and at the end of the day to be able to reach out to more people.
Inshallah. Inshallah, Allah subhanahu wa ta'ala take you and the Giving Hands Foundation from strength to strength. Inshallah, we will give your number to the viewers and inshallah they can then contact you and see how they can assist with regards to helping the Giving Hands help those who are in a desperate situation during these difficult times that we are going through. Muhammad Abeya, Chairperson of the Giving Hands, Jazakallah for giving us some of your time this morning. Please do remember us in your du'as and early Ramadan Mubarak to you and your family as well. Assalamu alaikum wa rahmatullahi wa barakatuh.
Shukran jazila wa alaikum salam wa rahmatullahi and Ramadan Mubarak to you and to all the listeners.
Ameen, inshallah. Muhammad Abeya, Chairperson of the Giving Hands Foundation. His contact number is 0824507723. You can call him or get into contact with him with regards to helping those in the Ermelo region, etc., and those other 4 places or cities that Muhammad made mention of, inshallah. As we know, everybody's going through economic hardship and distress at this moment in time. We find news just coming in as well that the President of South Africa will be addressing the nation once more today. So inshallah we'll be hearing what the President of South Africa has to say with regards to economic relief during these difficult times that we are all undergoing. It is day 26 of the lockdown in South Africa. We go for a short break, inshallah. When we come back, we'll be going to the United Kingdom, inshallah. We will be joined by a husband and wife, a South African couple based in UK, in East London. The wife does work for the NHS health system there in UK. So inshallah we're going to be talking about COVID-19 in the UK. After that, inshallah, this morning, inshallah, we will be trying to go live to the High Court in Pretoria, where the court will be ruling with regards to the unconstitutionality of the closing of the masajid. So inshallah we will be taking that court case live here on ITV Networks. Inshallah, if everything goes well, that will be after the interview here with Waleed and Fadila Masood from East London. We go for a break. Inshallah, we'll be back shortly. Welcome back to the COVID-19 update show here on ITV Networks. Once again, Tuesday morning, 27th day of Sha'ban 1441 year in South Africa. As we know, the COVID-19 pandemic, a worldwide issue, a worldwide pandemic, and we have different people in different parts of the world experiencing this COVID-19 pandemic under lockdown in a very different way. Alhamdulillah, this morning we're going to be speaking to a couple who are based in East London in the United Kingdom, and that is Brother Waleed and Sister Fadila Masood. We say Assalamu alaikum wa rahmatullahi wa barakatuh to both of you, and Jazakallah for taking out some of your time this morning to enlighten our viewers about the situation in the United Kingdom.
Walaikum salam wa rahmatullahi wa barakatuh.
Firstly, before we go on to exactly what is the situation in the United Kingdom, do any one of you want to just give us a brief history of how you people have landed up in the United Kingdom and what exactly are you guys doing there?
Yes, so we've been living in the UK for about
19 years, 18 years.
No,
Yes.
about 16 years now. We came here initially for work and ended up staying long term, and we quite established now here in East London, and we regularly visit home back in Cape Town as often as we can, as much as we can afford it, to visit our family and friends. So I work in the construction industry, and my wife Fadila, she works at the National Health Service in London. And our eldest kids, or son, Tashfiq, is currently at university, and the youngest one, Salman, is still at school.
Alhamdulillah, Waleed, for that brief introduction. With regards to the COVID-19 pandemic, we see South Africa experiencing day number 26 of the lockdown now. What's the condition there in East London where you guys are?
Well, currently we are both, I was working from home. I've been put on furlough, which is a paid leave with reduced salary from the company that I work for. So we are on a minimum of 3 weeks at home, with a possibility of extending it up to the end of May. Faldila is currently working from home. So she's able to access all the records from work and then contact patients and staff from home. And the kids are both doing their studies from home. My son, the eldest one who's at university, he's currently doing his online studies, and I think he'll be doing some exams online. And the younger one gets his schooling online as well.
Fadila, as a healthcare worker, then what does it mean to be working from home? If there is a lockdown, do patients then come to you, or how does it work?
So we had to change the way we deal with patients. So we still deal with patients on a daily basis. We try to keep things as normal as possible. Things have changed. We work in the community, but a lot of the 90% of the staff have been redeployed to work in wards that they've never ever done before for years. They've always worked in the community. So it's a scary thing for the staff to go into the hospitals, dealing with protective clothing. I spoke to one of the brothers, he's a pharmacist, and Numan said to me that they actually had to shave their beards in order to fit the mask and go for fitting. It's about saving a life. And he said that to change, they converted 52 ICU beds into 125 within a week. It's sad to see so many people lose their life. And, people get discharged. It's hugely uplifting, but it's also very sad when you see people die. And it's very scary because it's not something that they're used to, because they've never dealt with people in wards and with sick people. And there's a shortage of PPE, and a lot of the staff that's got families, that's got underlying issues, need to stay in hotels, which the NHS provide with the help of community. So they live in hotels at the moment, not to go to the houses, to their homes, and they don't spend time with their families. They don't see their families. They don't know if they're going to see their families ever again, because people actually die on a daily basis. And it's just so annoying when you see some people go out to parks and go for exercises, and which is unnecessary, because they work hard and we should stay at home and make it easier for them. But a lot of people don't do that.
You talk about communities then, Waleed and Fadila, with regards to the community that you people live in. What has been the response of the community abiding by the laws of the lockdown, etc.? And then also the Muslim community's response to the lockdown and the COVID-19 pandemic. We know many Muslim health workers were on the front line of the COVID-19 pandemic, have lost their lives, sadly. What is the response of the communities?
I think currently the communities, most people are sort of adhering to the government restrictions and guidelines, staying at home where they can. I can see the people in our community, most of them, as much as they can, try to stay at home. People are doing shopping online where they can. I usually go shopping at least maybe once a week for necessities, anything that we may need. We try to do as much exercise at home. Like I said, Faldila's working from home. I used to work from home. The kids as well. So we've set up something in the garden where we've got exercise. We've got an exercise bike that we use. There's a small gym that we can use, and so basically try and keep indoors. When I do go outside, try to wear the face mask and gloves just to stay protected. Come inside and then, wash yourself. So wash your clothes as soon as you come inside, take off your clothes, get a change of clothes, have a shower. The other things that we've got as well is that the government has sent out, at the start of this, before the lockdown started, the government sent out notifications to everyone, personal letters to everyone, basically advising as to restrictions, what you are allowed to do. So currently the government is allowing people to, if they have to go to work, they're allowed to go to work only if necessary, where possible, work from home. If you need to go to a pharmacy or the doctor to get medications, you're allowed to do that, and one form of exercise a day. So that's about it. And I think most people are trying to stick to that. Some shops, like takeaways now as well, have started opening recently in the last week or so, but you're only allowed to do phone orders, so either delivery to home or call in, and then they call you back just to say that your food's ready, and then you can quickly go and pick it up. The government's also arranged for assistance where volunteers we have over, I think, nearly 1 million volunteers, which are helping to support the elderly and those who aren't allowed to go out, because the government's also requested people with underlying health issues to try and stay at home for at least 6 weeks. For 12 weeks. So anyone with the likes of asthma or any conditions to that effect, the respiratory diseases especially, or illnesses, they've been requested to stay at home for at least 12 weeks. The government's also provided assistance whereby they've asked the banks and financial services to offer their clients mortgage holidays. So up to 3 months you can apply for mortgage holidays where you won't have to pay your mortgages or reduced rates. Credit card fees are being, there are no interest charges, no late fees. So government has sort of made some effort to try and help people as well. And there's also been benefits, some financial aid offered to members of the public as well, and to businesses to try and keep things afloat. So even self-employed people, so self-employed people, if you are self-employed, you can apply for a minimum of 2,500, or I think up to 2,500 a month to keep you tied over, as long as they have evidence that you have been working. Then people are entitled to those benefits.
So the government is making some sort of plans or for action for those that are affected by the COVID-19 pandemic. Fadila, from your side, being a healthcare worker, what does it feel like personally being on the front line, especially if you might be having friends that are on the front line, also Muslim doctors, with regards to combating the COVID-19 pandemic?
We online every day, so you get messages, and the NHS has been really, really good. They've got a thing where you can send in a message with a picture for your loved ones in the hospital, because we try not to let people come to the hospital. I work with people that's got HIV, so people like those that usually come every 3 months or 6 months for their blood tests and for their checkup, they get a delivery with their medication to the home delivery. We do online consultation, so they'll phone and I will book the appointment for them, make sure that they really do need to speak to someone. We do see some patients, but if you can give the medication, you come to the hospital. You cannot come just inside. They will give you a phone call when you sit in the car park, and then you get called inside, and then that way you get your medication, just make sure that's the person, etc. So things have changed differently of the way we work. We still do the same work, but it just changed completely. If you go to the hospital, because a lot of the people are scared to go, so they don't want to end up in A&E. They'll rather stay at home, and that's where they lose life as well, because you get people with heart conditions and having strokes, they're petrified to go to the hospital, basically. And we had a neighbour that went to hospital on Friday because she had to go. She didn't have a choice. And when she got there, she was just scared. But I said it's a different way of dealing. So once she had to use the loo because they needed to use a urine sample, and she was petrified, but they said to her, don't worry, somebody will come and clean her. And she said, no, she'd rather not. And then there was a person that went in before her. When that person came out, immediately a cleaner went and cleaned. And then she saw. They cleaned all the time. They're looking after the staff. They're looking after the people. The community has been amazing, honestly. The community sticks together. So we don't go out. The only time we ever went out was on Thursdays. Every Thursday night at 8 o'clock, we all clap hands right across the UK. And it's actually beautiful. It's actually very emotional to see that they actually appreciate the NHS because...
and it's all the other key workers as well.
Yeah,
so
they don't appreciate
looking
us.
after the elderly, people who are in for elderly care, support workers.
Yeah.
It's not only that, it's the police as well, it's the postmen, the people who are doing the cleaning. You still have the dirt collectors. They go around cleaning up, picking up people's dirt on a regular basis, a weekly basis. So those sort of essential services are still going on. So as far as possible, I think everyone is trying to pull together, because even in the Muslim communities as well, and not just that, but all over, everyone is coming together, trying to support one another. I mean, especially being indoors as well, the government, and even I know my place of work as well, they've also offered mental support for people. Obviously, some like we are fortunate, we have a garden that we can go out to during the day, whereas other people, they may be living in high-rise apartments or flats, and they don't have that facilities. So, you know, that can be mentally straining. And so the government has offered support for people with, you know, having mental issues or having that sort of, you know, financial worries, so that people can actually call in and look for support and actually speak to someone about that. And that goes for places of work are offering that as well. And I think that's one of the reasons why the government has actually try to implement this financial support for people where they can apply for in order to try and take some of that burden and some of that stress from people.
Because mental health issue is a big thing. I know in the Muslim community, we don't believe in mental health, which does exist, because mental health is a very big issue. I mean, I've known about patients that come there that will say, oh no, but you know, I must make dua. I said, yes, you can, you must make dua, but you also need help. And that's why we there, Allah Ta'ala put us there to help you. And that's why there is nurses and doctors that deal with mental health. And it's a serious issue that needs to be raised in today's society, because you have no idea what it is to live alone. We've got our family here. I don't have the rest of my family, my sister, my brothers and all, but we have each other. What about the next person living alone? How does that person cope? Then you got alcoholism, somebody that's addicted to alcohol. They go to meetings once a week. They can't go to meetings anymore. And if you look at our Jum'ah again, we had how many Jamaats? We have 3 Jamaats every Jum'ah. My brother-in-law, Zahiri, used to get shocked when he came to London, because he couldn't believe there was 3 Jamaat. Now we've got nothing. The mosque is all closed. Everything is closed. But those are issues that people don't realize, that they take for granted. And that's why we all look after each other in this neighborhood. Like, people will make sure that everything is fine. We've got an old man that we always take care of, but we don't see him. And he realized he could video call, so he started video calling us to find out if we're okay. Not the other way around, but because he misses us, and we just see each other on a Thursday. And we're like, well, he call us the hand clappers. When we go outside on a Thursday, clap hands.
Alhamdulillah. Walid and Fadila, very quickly, I just need you to give us a Ramadan message, and what's the feeling before the blessed month of Ramadan in the community that you live in under lockdown?
Okay, I think everybody over here is quite excited for Ramadan. Our boys especially, they've been counting down the days, reminding us that, you know, by the end of this week, we'll be starting Ramadan. We have neighbors across the way here as well, so alhamdulillah, they're looking forward to it as well. Generally in the community as well, around our streets, we have not too many Muslim brothers and sisters, but the non-Muslims as well, they are aware of what we do during Ramadan because we include them. So we've had the like we do back home in South Africa, where we go around from house to house and the neighbors exchange cakes and so forth. So we've done that year, and then we include them as well, so that they are actually aware, and a lot of them also look forward to that. So I think
we brought the tradition, yeah.
Yes.
Yeah.
So to everyone back home, we'd like to say Ramadan Mubarak, and we hope that you all have a blessed Ramadan, inshallah, and that make dua, inshallah, that all of this pandemic and this illness will be taken away, inshallah, as soon as possible, and it keeps us all safe. And to all our friends and family back home, Ramadan Mubarak to you as well. We miss you all. Stay safe, inshallah.
And my little niece, Soda, it's her birthday on Thursday, so happy birthday, Soda. Sorry, I can't see you, can't even buy a gift because I believe you people are not allowed to buy toys and stuff like that. We can buy anything. We can go and online and Amazon will deliver. Sorry, Soda. Soda, no, I can't get you a gift this time, but next year, inshallah, we'll make it double. And Auntie Fahma, my child, says his grandmother, Mama, Mubarak for your birthday on Saturday or Sunday. And everybody back home, Mubarak for Ramadan, all my sisters and brothers, inshallah. And my father-in-law, my mother-in-law, and everybody else, Mubarak on Ramadan, Mubarak.
Well, we can see even in the COVID-19 pandemic or lockdown, you can't forget the in-laws also when giving them a message. Fadila and Waleed, Jazakallah for joining us this morning, alhamdulillah, and painting the picture to our viewers here back home with regards to the lockdown in the United Kingdom and the COVID-19 pandemic in UK. May Allah subhanahu wa ta'ala keep you and your family safe at all times, inshallah. Please do remember us in your du'as. Also, assalamu alaikum wa rahmatullahi wa barakatuh. That's talking UK lockdown, a COVID-19 pandemic in the United Kingdom to South African, or the family of South Africans living there now in East London, and talking to us about what is the situation there at this moment in time. It is now 1 minute to 11 here on our COVID-19 update show. That brings us to the end of this morning's edition. As I made mention, inshallah, we will be going live this morning to the Pretoria High Court this morning, wherein we find a very unique case going to be heard there once more. We find the matter between Mr. Mohammed and two others versing the President of South Africa regarding the unconstitutionality of the COVID-19 lockdown. And this will be heard this morning at the Pretoria High Court starting in a few more minutes. And inshallah, this is going to be broadcasted live on ITV networks. We find that the United Ulama Council of South Africa has also applied to be a friend of the court in this matter. So inshallah, you will be watching what's going to be unveiling with regards to this matter here live in a few more minutes here on ITV networks. From myself and the rest of the team, enjoy the rest of your day. Please do remember us in your du'as. Fi amanillah. Assalamu alaikum wa rahmatullahi wa barakatuh.